Started off, I have a background, I did masters in clinical psychology, and as it is, I was interested in the psychological of human behavior, and then I shifted into journalism, and while doing my journalism, I did my law. Then I entered human rights law. After entering human rights law, I did a lot of advocacy on civil and political rights. I had gone to Punjab and done a research study on the 1984 riots, collecting data of more than 600 families who had disappeared. They were missing during the riots time. So thereafter, then I said the advocacy was done a lot, and then I came back to Bombay and I joined SEHAT, Center for Inquiry into Health and Allied Themes, and they needed a senior research officer, wherein my human rights background acted as a bridge towards health and human rights. And I conducted an international course on health and human rights therein. And then when I joined SEHAT, I got involved in women's reproductive rights, health issues, and then I joined the Right to Healthcare campaign and People's Health Movement and Jan Swasthya Abhiyan, wherein my journey started looking at health, the various social determinants of health, the rights-based advocacy. Health, it's the holistic well-being, your mental, emotional, physical, which cannot be taken out of the social context, which also includes our political economy, the politics which is going on, right? Now, if you look at a country right now, when you look at our budgets, what do we see? That the defense budget is increased, but we do not see any increase in social sector, which includes health and education, not even 1% of GDP. And whatever health you have, like we did a study in Maharashtra on the health budget, how is it utilized? And we came to the conclusion that 80% of health budget is capital investment. So where is the money for patients? Where is the money for medicine? Where is the money for, where are the priorities of the government? So I think health is a very political issue, and it should be looked as politically, and just not a social service or a social problem. So it has to be looked at a political context. Definitely, when I'm talking about right to health, it is based upon the social determinants itself. But social determinants on its own, what are they? When I'm talking about human rights, it's action on social determinants of health. So I have to have a rights-based language. Now we say, okay, the water, food, it's not available, which is affecting health. You have your social determinants if there is good water, but how will it be done? How will it be operationalized? So for operationalization of this approach, you have to have a rights-based framework. So actually, I wouldn't say that we are competing with each other, but I think we have to go hand in hand together. So SDH on its own, again, I don't think so can impact the changes within the health system. It can obviously have awareness and knowledge of what's happening, what are the social determinants, and social determinants actually can change. Yeah, and they are changing. As per the development and after the liberalization, globalization, and what all is working, and what we heard today also in our Farmer Society presentations, how the aspiring OPC is there, how the rural India and the urban India, almost there. It's just not black and white. Right now it's not happening. So you have to look at that. And also I think we need to talk about the multinational companies which are coming in, whether it's health sector or the pharmaceutical side, Monsanto, and the big pharma companies. The clinical trials happening where India is like it's like a dumping ground. India has become a dumping ground for clinical trials of various medicines, especially medicines related to mental health and schizophrenia. Yeah. So, and without the consent of people because they are illiterate. So, the issue of medical ethics, consent, I think they are all very minutely linked, but sadly we are not talking about all these issues. it has been used, but my problem will be that how it is implemented or whether it is implemented. We create this, white paper tigers, these policy documents, various committees coming in. But are they being implemented on the ground? What is the action which is happening? Which I very strongly feel that sometimes government just do it as a duty to keep us activists shut up. Okay, we are making a policy, right? I mean, the law has come now, so we are doing something. But what is happening on the ground is zilch. I mean, if I compare like 20, 30 years back, what has happened, what has been the state of affairs, and now, obviously there is a change. But what is the change in health sector? Except for privatization, except for more private players coming in. What has happened to the public health system? What is happening to the primary health care? It's actually in coma, it's on death's bed. And thanks to the public-private partnerships, which is being encouraged, because state is actually taking their hands off that we cannot take care because we don't have the money, we don't have the budget, so let private players come in. But do private players come in without their profit mentality? No. Let me give you an example. Charitable hospitals, which have come up in Bombay is also there. If you know that Leelavati, all these big, I call them big star, 5-star hospitals actually. They get land with such a small money and they're supposed to keep beds for the poor people. But no poor person is going to go to Leelavati. He's going to like, it's a 5-star hospital. I did a petition in the High Court that how many of these hospitals are actually giving. You have Atal Bihari Vajpayee, Amitabh Bachchan and all these people coming in all these hospitals and getting things done. But the poor people, are they really getting the benefit? No. And who are we serving? Again, that's a question. So it's whole political, corrupt nexus of MNCs and private health sector coming. And I very strongly feel that the medical community is very strong. If government is afraid of anybody, that is the doctors. Because I was involved in the PCPNDT Act, on sex selection which came up. And now doctors are saying that you should amend the PCPNDT Act because every doctor is being taken in, although no doctor has been convicted so far. No? But they are being harassed, So for me, doctors are like banyas. I'm sorry, there are few good doctors, friends I have. But doctors are like no banyas, unethical practice. And through PCPNDT, they are actually not giving access to abortion under the Medical Termination Pregnancy Act, which as a woman is my right. So the backlash happening. We need more people who are not medical because we need more research which is public health oriented and not medical or clinical. And I would actually request your students and people who are going to go into this path to do action research, and also to do action research especially for the marginalized population. Like for example, I would say gender, sexuality, disabled, sex workers, elderly, Dalits. These marginalized sections don't have voice and they need voices, and I think action research is one form of method which will give them voices. I mean, I wonder, any research study on homosexuality, on gay and lesbian discrimination. I mean, there have been studies on HIV. But have there been study on gay and lesbians being discriminated? So, there are many such areas which are not being touched. For example, also being in Gujarat, now I remembered, surrogacy. This is the hotbed of surrogacy, and now suddenly when the government is saying that commercial surrogacy will be, banned, and we have all the doctors coming because this is such a milking project, So, with the medical technology, I think you have to keep abreast of the medical technology, the way it is advancing and what it is getting, what are the pros and cons of that, which is affecting with the various social determinants of the health, to keeping them in the periphery of the knowledge and working on that.